Good morning, I'm Dr. Charafeddine. I'm with Dr. Labib, and we're going to talk about how at Eden we think outside the box when it comes to facial rejuvenation. We're going to tell you how we prepare our patients for their procedure and the importance of really looking into the cell to prepare the patient for the upcoming procedure. So, two patients getting the same procedure and having completely different recovery. One extremely swollen and not happy, uncomfortable. Both are getting good results. It's just how things went after the procedure. Now, the more important part is the patient who had taken care of herself, her hormones in check, her toxin levels extremely low, and her genetic testing showing that she's really younger than her real age. Obviously, her tissues felt much better, and her inside tissues on the face felt much better. And I was extremely happy doing her procedure. So I think the take-home message is there are things we have to look inside our body, inside the cells,
Yes.
that are really beyond the usual traditional medicine, like a CBC and a Chem7 that everybody, right, gets.
Absolutely.
But I think at an earlier age, when we start looking into hormones, when we get to that age where hormones start to have
Fluctuate.
some issues or fluctuate, I think it's very important to look at them. Now, test in this environment in 2024, where we live in big cities, or even if we live on a farm, you got to look into toxin exposure, because all of this affects the quality of the tissues. All of this affects your life, your recovery after you get any procedure, not necessarily a cosmetic or aesthetic procedure.
Yeah, and what I like to add is like those tests, give us an idea where the patient is, but depending on those tests, we will tailor the treatment option or maybe lowering more their inflammation through certain supplements, through IV therapies, maybe also after the procedure have more, red light therapies, and add more to what we're doing. So those tests not only give us information, they give us information in order to act on them and change things. And the nice thing about those tests is like even after a year or 2 years, they can repeat some of those tests and see where they are, where their biological age is, where their toxins are, and this will give them, incentive to work on their health in order, to feel young and look young and, and live longer, better health span and a better lifespan, of course.
So these two patients, one is aging at 1.2 chronological years every year.
Correct.
And the other one is aging at 0.8 years per year. She's aging slower, and the other one is aging faster. Is there something we can do to help the one aging a little bit?
Absolutely, yes. Of course, our genes are, predetermined from the day we're born, but they're not predetermined how they work, or how they express proteins or how they express themselves. So what we do on a daily basis is how we allow our genes to express themselves. We cannot change the genes, but we can change their function. Therefore, yes, the patient who's aging faster than her chronological age can definitely, look at where is the problem, what are the toxins she's exposed to, what is she doing in her life that's causing this damage, and accordingly try to slow down that process. So yes, absolutely, you can make a difference through multiple channels, multiple lifestyle changes, and of course the patient who's aging slower can even try to age even slower, but she's doing great, and very important to continue what she's doing so that the results, will last much longer, and she will feel better about it, of course.